Should you go for an IUI or an IVF? Which is better for you? It is not that if somebody is trying to conceive for quite some time and have some issues with conception and going through fertility treatments for quite some years, doesn't mean that you will have to go for an IVF. Decision of IVF depends on multiple factors like your complete history, your medical problems, semen parameters, uterus, ovaries, tube status, all these need to be considered. And depending on all the complete case scenario and all the findings, you will be suggested whether you can try smaller treatments like daycare procedures like an IUI, or do you have to go for an IVF. If there are recurrent IUI failures, like if there is no other problem and that means it is unexplained infertility and you have tried at least 6 times of an IUI, then you might be suggested an IVF. If there are tubal problems, both the tubes are blocked or absent or removed by any surgery, you will be suggested an IVF. If there is a decreased ovarian reserve, there is not much of time to try IUIs or natural process follicular studies, you might be suggested to go for an IVF to store your embryos before the reserve goes low. Things like this. So it is not a straightaway decision that you've been trying for so many years and you'll have to go for an IVF. It depends on what is your clinical profile. So it is always individualized, personalized plan when you go for fertility treatments. So consult your doctor, understand what is your profile, do the investigations and think what is better for you, IUI or an IVF.